Hi everyone and welcome to Exceptional Tuition and Resumes. Today we're going to go over some interview questions to prepare you for your future graduate nursing programs, and we're going to be focusing on situational questions. So basically what this means is, how are you going to deal with situations as a new nurse in the hospital or clinical environment? Okay, so let's get right onto it. So first question you may have is, how would you deal with a senior nurse speaking to you sternly or a little bit too firmly in front of your patients and their family members? So this sort of question is asking you, how would you deal with conflict which is happening in a public environment? So say you have a senior nurse who is not being as, calm towards you when they question you. So how would you respond to them in a way that maintains your professionalism as a nurse? So you think about, how do you respond in the presence of the family, the patients, and directly to the nurse? What is your problem solving technique here? Another question you might receive is, what would you do if you were on a shift and things were not recorded appropriately in the nursing documentation? So here it's basically asking you, how would you resolve a documentation error and how would you fix that error, but also making sure that there's a high level of accuracy in the documentation. Another question you may have is, a client or a patient is displaying difficult behavior. So how would you deal with this particular patient or client? So in this scenario, it's asking you to use your interpersonal skills, and how would you resolve the issue to turn it around so that the actual patient or client is positive towards you or more responsive. So it's basically asking you to identify, how would you identify the problem, what is the cause of their behavior, and how would you respond in a calm and keen manner, obviously respecting their dignity at all times, and how would you turn that difficult behavior into positive behavior. Okay. Another question you might receive is, what would you do if a child is admitted to emergency with a particular condition you've never heard of? So in this scenario, it's asking you basically, how would you increase your knowledge on the situation? How would you seek information from maybe someone who's more experienced in the emergency environment or with children? How would you problem solve to ensure that you deal with the child in the most appropriate manner? So how would you seek additional assistance from others? Okay. Another question could be, if you are feeling under pressure as a nurse, how would you cope within your shift? So this is basically asking you, how do you involve yourself in self-care whilst you're actually at work? Because obviously it's important to maintain composure when you are under pressure, but how do you deal with stress? Because obviously nursing is a very stressful occupation. It is the most humbling, most caring environment that you have to work in, but you have to obviously manage yourself. So what is your stress management techniques is what this question is asking you for. Another question would be, if a nurse was doing a procedure differently to how you were taught within your clinical placements or in your education, how would you deal with this situation? So it's basically testing your communication skills. It's testing how you exhibit open-mindedness, how you learn from other nurses, and do you come to a negotiated agreement as to, is your procedure and is your nurse's procedure coming to the correct end result and for the patient's welfare? Okay, so that's what's asking you. Another question could be, say if you have a patient that doesn't communicate in English, what strategies would you put in place to communicate with that patient? So in this scenario, it's again asking you about your interpersonal skills as a nurse. How do you break down those language barriers? How do you seek to communicate using your body language, pictures, using your staff around you, maybe someone speaks the same language as the patient. How do you basically communicate your message, what you wanted to say to the patient, with minimal language and communication barriers? Okay. Another question is, if you are feeling bored as a nurse in the clinical environment, how would you motivate yourself to get back on task and improve the situation? So it's basically asking, how do you bounce back when you have a time where there's nothing to do, or you just need more stimulation? What do you do as a nurse to motivate yourself? Because obviously being a nurse has a high level of emotional labor. So you need to think of, how do you manage yourself, how do you manage everyone else around you, and how do you improve every situation, okay? So as a whole, situation questions are basically asking you to describe your problem-solving strategies. It's asking you to describe, how do you respond to the people in the environment that you're in, the place that you're in, the observers who are in that situation. How do you maintain your professionalism as a nurse? How do you maintain your communication skills? And how do you basically ensure that you are a professional nurse at all times? Okay, so I wish you all the best with those particular situation questions, and we'll see you in the next video from Exceptional Tuition and Resumes. Oh, and if you need help with your resume, cover letter, LinkedIn profile, or selection criteria, please feel free to contact our team at Exceptional Tuition and Resumes. Have a wonderful day.